Hi, this is a pain drawing on my client Katie, who is very, very athletic, very fit. And we're going to keep her face out of the video to preserve her privacy. And she's going to tell her story. Today is visit number 3. And I'm very pleased with the progress she made. I had no expectation that we would make this much progress this quickly. And I'll take some credit for it. And a healthy body and motivation from the patient certainly accounts for much of her progress. And I'll let her tell the story.
I'd say about 20 months ago, after a regular workout, I came down with what physicians thought was peroneal tendinitis. After being in a walking boot for a couple months and it was unrelenting and steroid injections, lateral foot pain still wouldn't go away and I couldn't walk through my gait. I could only heel strike on the left foot. The right foot bothered me a little bit as well. Seen multiple PTs, and the only ones who have helped have been the ones who've realized that my cuboid was dropped. Originally thought so, but repeated relocations, picking it back up, still resulted in chronic pain, and I would drop the cuboid again every few months. It's been about 20 months now. I'm coming to see Dr. Hesch. He had a few different ideas of mobilizing the entire foot and ankle and up through the fibular head, as well as doing some SI adjustments. It's been about 3 weeks since the original meeting with him and adjusting it, and I think mainly through the rotational exercise he's giving me on my ankle, things have been in place. So now we'll just hope for the best and see if it continues to improve.
And can you elaborate on, is my mobilization technique for the foot and ankle different in any way from what you had experienced before?
I'd say you do lower velocity manipulations of the foot and ankle than what I've experienced. I've had a lot of similar manipulations with other practitioners, but they did very high velocity, quick manipulations that didn't seem to gain me mobility or the range of motion that I've gotten through your kind of slower, steady traction type manipulations.
And then the other question is, how many joints would they address in the foot and ankle? And just a rough guess, how many would I address in a visit?
An occasional practitioner would just do the cuboid. A couple of really good ones would maybe do 3 to 5 mobilizations throughout the foot and ankle, and I'd say you consistently would check almost every one in the foot and ankle, which is innumerous, more than I'm aware of.
Very good. And so what was your pain rating when you came in, and what is it now? And then how do you feel that you're able to go forward?
I'd say my pain was about a 4. Right now it's a 0 to a 1 generally. And going forward, I think we'll just start through the regular PT process and strengthening the foot, but keep going with your kind of moderate long holding adjustments you've taught me how to do, and hope this will be the time that it's different and things stay in place.
Very good. So I've seen you, well, actually just twice, right? Mm-hmm. For treatment. Today we found there was nothing to add. So do you think this is a bad business model?
Not for my wallet.
We joke about that oftentimes. And thanks very much for letting us film you. And I'm delighted with your progress.
Thank you.
So we'll see you on an as-needed basis from now on.
Okay.